Federal data shows the Delta variant of COVID-19 may be as contagious as chickenpox and cause more severe illness. Here to answer your questions is Dr. Gabriela Andujar-Vasquez, an infectious disease specialist and the associate hospital epidemiologist at Tufts Medical Center. Good to see you, doctor.
Good to see you all.
All right, it's a busy day on the COVID headlines. We've heard COVID compared to the flu before, but never to chickenpox. Now, those of us maybe born in the 80s or earlier would kind of equate to this because, if one kid in the classroom got it, everybody did. But why put this Delta variant in that same category as the chickenpox? And do you think that's an accurate comparison?
Yeah, I think that this can confuse a lot of people, right? Because like you said, we are used to thinking of chickenpox to be very contagious. I think what they're trying to say in the CDC is that we knew that the Delta variant was more transmissible, right? More contagious. And they're trying to compare it to a disease that we know and relate. The mode of transmission of COVID has not changed, right? It's still droplet and person-to-person contact with an infectious person. But it means that it can be, when you're infected, you can infect maybe more people than the other variants that we have seen before.
In many ways, it seems as though the Delta variant is an entirely different disease right now. What worries you most as you look at the data coming in?
Right. I think that we're still seeing that in terms of clinically, the patients that we are seeing have the same symptoms and the same progression of disease that we have been seeing with the other variants. But it is more contagious, and for that matter, it's important to make sure that we continue some of those safety measures that we've been talking about, including now, most importantly, vaccination.
All right, let's talk about the recent cluster of cases in Provincetown. You've read the report the CDC released today. Nearly 75% of the infections occurred in people fully vaccinated, and about 80% of them did experience symptoms. Is that a sign? Do you have any concern that that is a sign the vaccines might not be working as well as they should?
Right. So the Provincetown outbreak cannot be taken as an example of vaccine effectiveness, right? Because what we need to know is the denominator, the number of people that are fully vaccinated within that percentage that was given in the report. If you think about it, if a large proportion, like we know in Barnstable County, are vaccinated, then the likelihood of that proportion to be bigger in the fully vaccinated becomes bigger. So I think that we cannot make conclusions about vaccine effectiveness. I think these vaccines are still quite very protective against COVID-19, including the Delta variant.
Okay, you probably already know this, but people are exhausted in many cases. They do not want to wear masks again. They don't want to cancel their plans. They don't want to think about another shot, too. So what is our future if we decide we've already done what we can here and we're not doing anything else?
I think we still have a lot of room for improvement. I think that we need to get people that are unvaccinated vaccinated. And I think that's our first step to getting out of this. And then trying to protect and just push on a little bit more on those safety measures like masking for the people that have weak immune system or are more likely to get severe illness until we can get a big proportion, not only in our state, but in our nation, vaccinated.
All right, Dr. Andujar-Vasquez, good to see you. Have a good weekend.
You too.